Hello everyone. We will wait for a couple of minutes and start the session at 8 sharp. Hello. Hello and welcome to INICET May 2024 recall session by Manipal MedAce. In this session, we will be covering community medicine. I'm Dr. Vidya, your community medicine SME. So I'm sure most of you are already aware of the fact that this year, that is May 2024, there were few questions from community medicine, right? This usually doesn't happen, and it means only two things. One, do not stop studying community medicine. Two, in fact, you should give the subject more importance now, because since there was less questions in this particular exam, there may be more questions in the upcoming exams. So I'm covering a total of 12 questions in this session. 6 of them are directly from community medicine, and remaining of them are, there is an overlap between PSM and other subjects like pathology, dermatology, pediatrics, microbiology, etc. So with this background, let us start with our first question. Okay, so let us start with the first question. You are a paramedic responding to a multi-vehicle road traffic accident involving several casualties. All right. Upon arrival, you find a patient with a life-threatening condition. So let us pause here. So what are they talking about here? It's disaster, right? So the minute you see several casualties, more than one casualty, right, you can come to the conclusion that it needs triage, right? Because there are more casualties. So what is triage basically? So it is classification of disaster affected victims based on the severity. And why do we do triage? To efficiently utilize the resources, right? If there was only one patient, we would attend to that patient. But there are several casualties now, so we need to classify them based on the severity. So that is what they've tested here, right? Disaster triage system. So let us continue with the question. Utilize the triage system and color coding to assess and prioritize the patient's care. So what are the colors given here? Red, green, black and yellow. So the key word here is life-threatening condition, right? So the patient is suffering from a life-threatening condition. So what is the color code you give it to this particular patient? It is red, right? Red is for danger. That is how we remember. Red is life-threatening condition. So let us revise the color codes once, right? This is taken from my notes, which is given in Manipal MedAce app. So black is dead or moribund patients, all right? If a patient is dead or moribund, what is moribund? Almost dead, right? Even if you give him medical attention, the chances of survival are very less. So that is black category. What is green? Ambulatory patients, right? So they are all right. There are very minor injuries, so you need to give them first aid, right? That is green or ambulatory patients. What is red? Red is high priority patient, that is some life-threatening condition. And if you give medical attention to this particular category, the chances of survival are very, very high. So that's why the color red. Yellow is between green and red, that is medium priority patients. So this is how you categorize the patients. This is the disaster triage system. So we have studied this multiple times, right? In the videos, notes, we've discussed in the notes, MCQs, PYQs. So this is from a must-know topic, and I'm sure all of you have marked this correctly. So moving on to the next question. which of the following about rotavirus vaccine is correct, right? So I keep telling every exam at least one question will be there from vaccines, and in fact in this exam there were two questions. So we will discuss both of them here. So the question they've asked us related to rotavirus vaccine. So the options are subunit vaccine, administered through oral route, not given after 6 months, doses 2 drops, right? So what is the correct option they're asking? So is rotavirus a subunit vaccine? No, it is a live vaccine. So what is the difference between a live vaccine and a subunit vaccine? In case of live vaccine, you've taken the entire organism and you've attenuated it, right? Whereas in case of subunit vaccine, you've taken a subunit of the virus or any organism like a polysaccharide or protein or viral part like DNA or RNA, right? So that is what a subunit vaccine. Example, recombinant vaccine also is under subunit vaccine. So it's not a subunit vaccine. Rotavirus is a live vaccine. Administered through oral route. Is this correct? Yes. Rotavirus is given through oral route. So this is the correct option. Let us look at the other options as well. Not given after 6 months. Alright. So this is wrong. So most of you thought since the schedule is 6, 10, 14 weeks, this is wrong. It is not given after 6 months. Actually the guidelines say it can be given up to 8 months. So after 8 months you cannot give because chances of interception are more. Again, there are various there are various types of rotavirus vaccines like RotaVac, RotaSil, RotaTech. Okay, so RotaVac, if you take, which is given under the national immunization schedule, which is prepared by the Bharat Biotech, it can be given up to 8 months. Okay, and the dose is 2 drops. Is it 2 drops? No. So rotavirus vaccine is 5 drops. So which is 2 drops? Polio, right? We remember, right? Do boond zindagi ke liye, that is polio. So rotavirus is 5 drops. So what is the correct option here? It is administered through oral route is the correct option. So what are the types of questions coming from vaccines? So they're asking the type of vaccine, whether it is a live vaccine, subunit vaccine, killed vaccine, right? Or the next thing they're asking is the route, okay? And then they're asking the upper limit, till what age we can give the vaccine, and the dosage, right? So these are the things we need to highlight when while studying vaccines. So let us look at the routes of administration of different vaccines, right? So if you take BCG, so I'm discussing the vaccines which are there under the national immunization schedule. So BCG, if you take, what is the route of administration of BCG? It is intradermal, right? So if you take fractional IPV, again it is intradermal route. Okay, so BCG is given in the left upper arm, okay, and fractional IPV is given in the right upper arm. Okay, so BCG is given in the left upper arm and fractional IPV is given in the right upper arm. So this is one set of vaccines which are given through intradermal route. So if you look at the second set of vaccines, that is MR and JE. So these two are given through subcutaneous route, right? MR is given through subcutaneous route as well as JE is given through subcutaneous route. So if you look at the site of MR, it is right upper arm, okay, and if you look at the site of JE, it is left upper arm. Okay, so JE is available in two forms. One is killed vaccine and another one is live vaccine. So the one which we are using under the national immunization schedule currently is the live form, which is given subcutaneously. Okay, killed form is also available in India. There is a recent update that the Kola strain is being used, all right, as a killed vaccine for preparing killed vaccine, and that is given through intramuscular route. Okay, moving on to the next set of vaccines which are given through oral route. So can you name 3 vaccines which are given through oral route? One is oral polio virus vaccine, rotavirus, all right, and the last one is vitamin A prophylaxis. So these 3 are given through oral route. So rest of the vaccines, okay, what are the vaccines remaining now? All the T series vaccines, that is TT, hepatitis B, DPT, pentavalent, all of them are given through intramuscular route, all right. So these are the routes of administration of different vaccines which are given under national immunization schedule. So if you had studied this, you could have answered this correctly, and I'm sure you've answered this correctly. So this is the RotaVac, all right, which is given under National Immunization Schedule. So it comes with a pink dropper, all right. So you take 5 drops and administer it to the child. So what is the schedule? You can give it at 6th week. You are supposed to give it at 6th week, 10th week and 14th week, right? So 1.5 months, 2.5 months, 3.5 months. So the question was there. I mean, one of the options was not given after 6 months. So some of you got confused because 14th week was the last dose. No, according to NTAGI, that is National Technical Advisory Group on Immunization, NTAGI, it can be given up to 8 months. All right, this is what you need to know about rotavirus vaccine. So moving on to the next question, which is again on vaccine. This shows the importance of vaccines, right? We need to know everything about vaccines. So which of the following is not a polysaccharide vaccine? So they've asked the type of vaccine here. So what are the options given here? Hepatitis B, meningococcal, Haemophilus and Streptococcus. So which of the following is not a polysaccharide vaccine? Okay, we should not miss such words like not, incorrect, except. So the answer is what here? It is hepatitis B, right? So we are all medical professionals. We all have taken hepatitis B in the UG period itself, right? So it's a recombinant vaccine. So how do you prepare recombinant vaccine? You take the RNA or DNA of the organism and inject it into virus or yeast cells, and that is how you prepare a recombinant vaccine, right? So hepatitis B is a recombinant vaccine. So all the other 3 are polysaccharide vaccines, right? So your option is hepatitis B, the correct option. So let us revise the types of vaccines now. All right. So there are totally 6 different types of vaccines. Live attenuated. So it's a live organism. You've attenuated it, that is inactivated it, weakened it by using a chemical. Right. What are the live vaccines? So there is tuberculosis, that is BCG, yellow fever, oral polio virus, MMR, that is measles, mumps, rubella, typhoid, varicella, rotavirus, cholera, influenza, zoster, right? Similarly, if you look at killed whole organisms, there is typhoid. Okay, so actually there is a mnemonic to remember killed vaccines. Some of you have asked me, ma'am, how to remember these types of vaccines. The list is so lengthy, right? So I have a mnemonic for killed vaccines. With this, I remember all the killed vaccines. And the vaccines which are not there in this category will go into live vaccines. And also I remember BCG, oral polio virus, MMR, all these vaccines are live vaccines, right? So what is the mnemonic I'm talking about here? A Japanese influenza, okay, with type A personality, went into a forest, was bitten by a wild cat and developed rabies and died, right? That's why it's killed, right? Killed vaccines. So J for Japanese encephalitis. So done. Influenza, you can take influenza, all right? Okay, and then type A, hepatitis A. Personality, that is P, plague and pertussis. Also polio, IPV, all right? IPV you can take here also for I or for P, all right? And F forest, Casno forest disease, all right? C for cholera and COVID-19. Rabies is rabies, okay? One more T is here, so you can put it under type A. So typhoid and typhus come under killed vaccines. Again, live vaccines are also available if you look at typhoid, right? So this is how I remember all the killed vaccines. Moving on to the next category of vaccines, that is toxoid, all right? The vaccines are developed against toxins here. So what are the organisms which produces toxins? Based on that you can guess the organisms here. One is diphtheria, tetanus, cellular pertussis, anthrax and influenza subunit, all right? So all these organisms, that is DPT and anthrax, they produce toxins. So we have toxoids against that. So moving on to the next set of vaccines, polysaccharide, right? Here the vaccine is produced against the sugar molecule which is there on the cell membrane. I'm sure you have studied this in microbiology. So the vaccines here are pneumococcus, meningococcus, Haemophilus influenza and typhoid, all right? Glycoconjugate, again we have Haemophilus influenza, pneumococcus and meningococcus. Usually we don't give polysaccharide less than 2 years, so we have glycoconjugate also. So what is glycoconjugate? Your sugar molecule is conjugated with a protein particle, right? So that is what is a glycoconjugate. Recombinant I've already explained. So the mnemonic for this is H2C2L, all right? H is hepatitis B virus, another H is human papilloma virus, and then if you take C, cholera toxin B and COVID-19, L for Lyme disease. So these are the 6 varieties of vaccines, right? Live, killed, toxoid, polysaccharide, glycoconjugate, recombinant. Very, very important. So moving on to the next question. This is from tuberculosis topic. I'm sure Dr. Meenakshi has covered this in microbiology, but since this is tuberculosis, one of you had asked me, all right, that's why I'm covering this here. What is this question? There are, there is an assertion plus the reason. So we need to see what is correct, what is not, or if both are correct. So assertion is, before taking the sputum sample from suspected tuberculosis patient, the sputum is treated with N-acetylcysteine and sodium hydroxide. The reason given is N-acetylcysteine kills the oral commensals. So what is correct here? Assertion, reason, or both correct, both false? Okay, so of course we treat sputum with N-acetylcysteine and sodium hydroxide. The reason is N-acetylcysteine liquefies the mucus, all right, in the sputum. So the organism is released from the mucus. You can easily identify it under the microscope. If you take sodium hydroxide, this kills the other organisms, okay, other oral commensals, but this does not do anything to Mycobacterium tuberculosis, because Mycobacterium tuberculosis organism is resistant to sodium hydroxide. So the reason is wrong, right? Reasoning is wrong because it's not N-acetylcysteine, it is a sodium hydroxide which kills the other oral commensals. So what is the option? Appropriate option A is true, that is assertion is true, reason is false. So this should be your answer. Again, every year at least one question will be there from tuberculosis. So till now we have covered the most important topics: disaster, vaccines and tuberculosis. Every year you see minimum one question from each of these topics, right? So moving on to the next question, which is Kaplan-Meier curve. So when I looked at this curve, I was really happy, thinking they've asked something from survival analysis, because we have covered this in the videos, right? But there is a slight twist. They have clubbed it with patho. There is an overlap between pathology and PSM here, right? So it is covered in both the subjects. So what is this curve? It's a Kaplan-Meier curve. So this image was received from one of the students, all right, after the exam. So in the x-axis, as you can see, there is time after grafting days. Always in the x-axis there is time, we all know that. In the y-axis, what do we have? Surviving grafts percentage of survival. So there is 0 here, there is 100% here, right? So what is this graph saying? So some patients who underwent grafting started follow-up at 0th day, right? At the end of 15 days, those who were on anti-CD8 showed reactions in the sense events. So whenever there is a decline, there is, step ladder fashion it is there, no? So whenever there is a line like this, it means that whenever it goes down, the line goes down, it means that there is a significant event which has happened. It may be graft rejection, death or loss to follow-up, all right? So those who were on anti-CD8 showed significant events on the 15th day itself, around 15 days. So if you look at the patients who were on anti-CD4, around 30th day, they showed the events. But those who were on anti-CD4 and anti-CD8 both, okay, they survived up to this particular period, okay, and they started showing reaction around 60th day. So what is better? Anti-CD4 and anti-CD8 both are better, all right? So this is how PSM we explain Kaplan-Meier curve. You know survival analysis, we have life table method and Kaplan-Meier method. So what is survival analysis basically? So for example, if there is a newer treatment against cancer, and if you've administered that newer treatment for around 100 patients, and if you follow them up for a period of say 5 years, at the end of it, if you're observing the number of events, it becomes life table method, right? And if you are taking all the events into consideration, whenever an event happens, you're taking that into consideration, that becomes Kaplan-Meier method, right? So both of them are survival analysis, right? So look at the options for this particular question. CD4 and CD8 both play a role in graft rejection, all right? So when anti-CD4, anti-CD8 as delayed, that means CD4 and CD8 both have played a role in, both play a role in graft rejection. So even though you don't know how to interpret Kaplan-Meier, if you've studied this in patho, that is CD4, CD8 play a role in graft rejection, you could have answered this. I'm sure you answered this correctly. So CD8 alone plays a role in graft rejection. CD8 and CD4, they are wrong. So the correct option would be the first one, right? That is CD4 and CD8 both play a role. So moving on to the next question. Again, this is from patho, but one of you had asked me, so I'm covering it here because there is malaria, filaria. So which of the following infections can be transmitted through the transfusion of blood components, right? So let us look at the diseases they've given. Toxoplasmosis, which is caused by Toxoplasma gondii. Filaria is caused by filarial worms. Malaria, Plasmodium species. Syphilis, Treponema. So if you look at this, malaria and syphilis are the options which come to our mind, right? But if you see malaria, more chances because the parasite can survive for a longer period in the blood. But syphilis, it's extremely rare. The organism is highly fragile, so it's extremely rare for it to survive in the blood. So the best option would be malaria. Okay. Moving on to the next question. This is leprosy. Again, we study leprosy in dermatology, right, in detail. Dr. Shimona has explained in detail, and pharmacology, plus in community medicine also you study the programs. So what is the question asked here? Which of the following drugs used to treat leprosy can cause hyperpigmentation? The options given are dapsone, rifampicin, clofazimine and ofloxacin. So the most appropriate option or the most correct option here is clofazimine, right? So this causes hyperpigmentation. So before looking at the side effects of all of these drugs, let us revise the schedule once for multibacillary and paucibacillary. So what is the schedule? What is the regimen? We use rifampicin and clofazimine monthly, clofazimine and dapsone daily. So rifampicin dosage is 600 mg, clofazimine dosage is 300 mg, right? So this is given monthly once. And daily you give clofazimine 50 mg and dapsone 100 mg. Okay, and this is for 12 months duration. So this is what is multibacillary leprosy. So similarly, if you look at paucibacillary, you give it for 6 months. So what do you give? You take rifampicin, okay, 600 mg monthly, and then dapsone 100 mg daily. So you're not giving clofazimine here in case of paucibacillary, and the patient is supposed to complete the treatment within 6 months. So it's given for 6 months, right? And then multibacillary is for 12 months. So this is the regimen for multibacillary and paucibacillary. So now let us look at the side effects of all of these drugs. So dapsone, what are the side effects? Hemolysis, methemoglobinemia, peripheral neuropathy, hepatotoxicity or granulocytosis. So these are the side effects of dapsone. If you look at rifampicin, this you must know: hepatotoxicity, liver damage, right? Orange discoloration of body fluids and thrombocytopenia. So very, very important side effects I've written here. Okay, there are other side effects as well. Ofloxacin is gastrointestinal disturbances and cardiotoxicity. So clofazimine, there is reddish brown discoloration of cornea, conjunctiva, crystal deposition in tissues leading to granulomatous reaction and hyperpigmentation. So the answer for the question is clofazimine. Okay. Moving on to the next question, what is covered in Declaration of Oslo? Again, this is covered in forensic medicine, right? But one of you had asked me, so I'm covering this here. So is it torture which is highlighted, or definition of death, therapeutic death or abortion, or right of patients? So the answer for this is, so there is no common sense question, you need to recall this, right? Okay, so it is therapeutic death, right? The correct option for this is therapeutic death. Okay, so if you look at the other options, that is torture, that is highlighted under World Medical Association Declaration of Tokyo, Definition of death. Yes, Vivan, correct. Abortion. Yeah. Torture is Tokyo, T for T, right? Definition of death, World Medical Association Declaration of Sydney, right? D is their death. Right of patients, World Medical Association Declaration of Lisbon. And then therapeutic death or abortion is World Medical Declaration of Oslo. So what has been covered under this particular declaration, that the importance of taking consent from the patients, and also the causes for which abortion can be done, and also the rights of physicians to refuse to perform abortions. So all of those are covered under the Declaration of Oslo. So along with this, we need to remember other declarations and codes which are very, very important. Okay, Helsinki Declaration, which which cover ethical guidelines which should be followed while conducting research, clinical trials. All right, Nuremberg Code, this highlights the basic principles of research, that is the importance of consent, requirement to avoid injury and suffering, right, while carrying out studies. We should not harm patients. Necessity of beneficial results, right? So that is covered under Nuremberg Code. Belmont Report, 3 ethical principles. There are basically 4 ethical principles now, right? Beneficence, non-maleficence, autonomy, justice. Under that, 3 have been covered under Belmont Report, that is respect for persons, beneficence, and justice. Declaration of Geneva is like modern version of Hippocratic Oath. Ethical duties of physicians are highlighted under this. All right. So these are the declarations and codes which are important for your upcoming exams. So moving on to the next question, which is again PSM psychiatry, that is overlap, which is not included in the mental health action plan. All right. So if you look at the options with common sense only, we can guess the correct answer here. So there is OCD, obsessive compulsive disorder, depression, mental. Yes, it is important for NEET PG also, Vivan, because Helsinki, Nuremberg Code, they are important for NEET PG exams. All right. Moving on to the other options, mental disorders in children and schizophrenia. So what are the disorders which have a major burden, right? So it is schizophrenia, depression, and mental disorders in children, right? So your safest option would be OCD. All right. So what is this mental health action plan? You will study this in psychiatry as well. So it was implemented in the year 2013. Okay. The target should be achieved by 2030. So what are the objectives? All right. Objectives are almost the same for all the programs if you carefully observe. To strengthen effective leadership and governance for mental health, this should be there, right? And comprehensive and integrated mental health. What is integrated mental health? The mental health care services should be integrated with general health care services. So mental hospital should not be an isolated hospital. It should be within the general health hospital, right? Otherwise there is stigma, right? Previously we used to have mental asylums. Whenever a patient went there, a lot of stigma was associated with that particular patient. To avoid that, we have this integrated mental health services. Objective 3 is strategies for prevention and promotion of mental health. All the programs you see in PSM, they give more importance to prevention, because prevention is better than cure. You all know that. And the last objective is strengthen evidence and research. All right. So this may not come for your entrance exams, but this is very, very important. So what are the disorders covered under this particular mental health action plan? Okay. So you have common mental disorders like depression and anxiety, which is covered. Severe mental disorders like schizophrenia, bipolar disorder, child, adolescent mental health disorder, ADHD, attention deficit hyperactive disorder, and autism. So these 3 are contributing to a major burden, right? So these are the options which you should look for. OCD is here, the 7th one. Okay, OCD is also there. Of course, they've covered OCD also, but compared to the first 3 options, it is given less importance. First 3 disorders, it is given less importance. So what are the other disorders? Substance use disorder, neurodevelopmental disorder, disorders due to stress and trauma, OCD, personality disorder, dementia, eating disorder, and suicides. So all of these diseases are given importance under mental health action plan. So moving on to the next question. How to sterilize disposable pipette. Again, this is overlap between PSM and microbiology. I have covered this in PSM lectures, right? It is there in the app. So the key words which we should look for here are one is sterilize, right? So what is sterilization? You're killing organisms, microorganisms plus spores. Okay, and then disposable pipette. So usually disposable pipette is what? Not glass pipette. It is usually a plastic pipette which you dispose of. So if this question was asked like this itself, the answer for this is glutaraldehyde, right? Because in autoclave there is high temperature, right? High temperature plus high pressure. We are sterilizing using steam. The temperature is 120 degrees centigrade for around 15 minutes, right? So what are the materials which can be sterilized using autoclave? Linen, dressings, culture, media, all right, syringes, gloves, etc. If you put plastic pipette, it melts off. So you are not supposed to put plastic or sharps into autoclave. Alcohol is a disinfectant. It kills the microorganisms, right? It does not sterilize. And then the hot air oven, again, the temperature is too high, 160 degrees centigrade to 180 degrees centigrade, right? 1 to 2 hours, over 1 to 2 hours, high temperature is maintained, it sterilizes. Again, if you use a disposable pipette, it melts off. So the safest option would be glutaraldehyde, all right? So this particular table is from the app itself, right? From my notes. So let us revise the disinfectants used to disinfectant the standard materials which are used in the hospital settings, right? So one is glutaraldehyde. It is used to disinfect fibroscope and respiratory equipment. Orthophthaldehyde for scopes. Iodine compounds as an antiseptic. Alcohol, antiseptic and disinfectant. Phenol as surface disinfectant. Peracetic acid, fibroscopes. Chlorines, surface disinfectant, also to clean blood and body fluid spills. Hydrogen peroxide, fogging of operating room for endoscopes. Formaldehyde is for OT rooms and labs. Okay. So to disinfect sputum, we use 5% cresol or burning method or autoclave. Plastic equipment, we can use ethylene oxide. Operation theatre, we put disposable plastic in red, right? Red is plastic, yellow is infectious, Vivan. Operation theatre is formaldehyde. Drinking water, UV radiation. Feces and urine, bleaching powder and crude phenol. Endoscope is glutaraldehyde. Alright, so all these aldehydes are used for scopes, endoscopes, fibroscopes, etc. Alright, so moving on to the next question. All the following signs are seen in severe dehydration except. So some of you told me the question asked was about some dehydration, some of you told me severe dehydration, whatever it is. If we understand the concept, we can answer any of the question, right? The options given were delayed skin pinch, sunken eye, increased thirst, lethargy. So what is the sign which is seen in severe dehydration? Seen in severe dehydration, right? So is it delayed skin pinch? Sorry, there is except also. Okay, so there is except. Okay, all of the following signs are seen in severe dehydration except delayed skin pinch. Do you see this in severe dehydration? Yes. So when you pinch the skin, it takes more than 2 seconds to go back, right? Retract. So this is present. Sunken eye, do you see it in severe dehydration? Of course you see that, right? The eye is actually more sunken in severe dehydration. Lethargy, yes, of course you see. Sometimes the patient is unconscious also, the kid is unconscious also. Okay, increased thirst. Okay, so increased thirst you do not see in severe dehydration, you see that in some dehydration. So the kids who are severely dehydrated are actually not able to drink, they poorly take fluids, right? Poor drinking is there. So increased thirst is the option for severe dehydration. I mean, all of them are seen except increased thirst. It is not seen in severe dehydration. The kid is not able to drink. Okay. So let us remove all the confusions. Let us revise this table once. So there are 3 categories, right? No dehydration, some dehydration and severe dehydration. Actually, mild, moderate, severe was used previously. So we have no dehydration, some dehydration and severe dehydration now. So basically there is some and severe. Okay, 2 categories. So in case of no dehydration, if you see, the mental status is alert, it's well, right? Some dehydration, normal, fatigued or irritable. In case of severe dehydration, lethargy or unconscious. Okay, unconsciousness also can be seen in case of severe dehydration. So this is with respect to mental status. So thirst, if you see, the kid drinks normally, okay, because there is no dehydration. Sometimes he might refuse liquids. But if you look at some dehydration, the kid is thirsty and is eager to drink, is asking for fluids. But if you look at severe dehydration, the kid drinks poorly, not able to drink. Okay, the kid is not able to drink. So this was the question option which was there in the question. So when you look at the pulse, it is normal in no dehydration, normal to decrease in case of some dehydration, that is bradycardia. But if you look at severe dehydration, there may be bradycardia or tachycardia. Eyes normal, slightly sunken, deeply sunken in case of severe dehydration. Mouth and tongue moist in case of no dehydration. In case of some dehydration, it is dry. In case of severe dehydration, it is very dry, right? It is parched. Mouth and tongue are parched. Skin fold, instant recoil. If you pinch the skin, it goes back immediately. In case of some dehydration, it takes less than 2 seconds. And in case of severe dehydration, it takes more than 2 seconds, right? Urine output, normal to decreased. In case of no dehydration, some dehydration, it is decreased. And in case of severe dehydration, it is very minimal, all right? So this is the classification of dehydration, very, very important, right? It is covered in PSM as well as in pediatrics. So moving on to the last question, which is very, very important again. Okay, again, we have discussed this in the videos, right? PSM. A 6-year-old has the following anthropometric measurements. Weight for ages less than -3 standard deviation. Height for ages less than -2.5 standard deviation. Weight for height is less than -1.7 standard deviation. Which of the following is the correct diagnosis? Is it acute malnutrition, chronic malnutrition, acute on chronic malnutrition, or moderate acute malnutrition? Right? So I hope you've marked this correctly because we've discussed this. I hope you didn't get scared looking at these values, right? The minute we see the numbers in any question, we get scared and tend to skip because time is very, very less in the exams. But I hope some of you have answered this also correctly. So what is this question now? So we need to understand the normal limit first, all right? Normal range. So what is a normal range? Between +2 standard deviation to -2 standard deviation, right? So this is the normal range for weight for age, height for age, weight for height, for anything. So what is weight for age here? It is -3 standard deviation, okay? So it is here. So is it in the normal range? So normal range is here, +2 standard deviation to -2 standard deviation. So it is obviously outside the normal range. So weight for age is decreased, right? Height for age, if you look, it is 2.5 standard deviation. Again, it is in the outside of this normal range, okay? So again, this is decreased. But if you look at weight for height, it is 1.7 standard deviation, -1.7 standard deviation, right? So where does it come? Here, right? So is it in the normal range? Yes. Okay. So in this particular scenario, weight for age is decreased, height for age is decreased, weight for height is normal. Okay. So this is the first thing you need to notice. The second thing you need to know is, to answer this particular question, weight for height is an indicator of acute on chronic malnutrition, right? Because it tells us about wasting. Whereas height for age is an indicator for chronic malnutrition. If a kid's height is decreased, that means there is malnutrition for a very long period, right? Months or years. Acute is few months, right? So chronic is long term malnutrition is there. That's why it has affected height. Okay. So the safe option would be here. The safe option would be chronic malnutrition, right? Because it's clearly not acute on chronic malnutrition because weight for height is normal. And some of you have asked why not it is acute on chronic malnutrition, because weight for age is decreased. So weight for age is decreased in this particular scenario because height for age is decreased. When height is decreased, weight also goes down. So that is the reason, that is the explanation for weight for age being less. But when you look at weight for height, it is normal, it is in the normal range. So your option should not be acute on chronic malnutrition and it should be chronic malnutrition. All right. So let us revise the classification again. Okay, a WHO classification of malnutrition. So if you look at the standard deviation, there are three ranges: 0 to -2 standard deviation, -2 standard deviation to -3 standard deviation, and less than -3 standard deviation. All right. So length for age or height for age. Okay. If it is 0 to -2 standard deviation, it is normal. Less than -2 to -3 is stunted. Less than -3 is severely stunted. So weight for age, here it is normal, underweight, severely underweight. Okay, but if you take weight for height, 0 to -2 is normal, -2 to -3 is wasted or moderately acute malnutrition. So this was also there in the options, right, in the question. Less than -3 is severely wasted or severe acute malnutrition. SAM criteria, right? SAM is severe acute malnutrition. So again, if you look at the SAM criteria, which is very, very important, 6 months to 5 years and less than 6 months, it is different. Weight for height, it is the same, less than -3 standard deviation and less than -3 standard deviation in both the categories, that is 6 months to 5 years and less than 6 months. If you take mid upper arm circumference, less than 11.5 centimeters, that is 115 millimeters. In case of less than 6 months, we don't measure mid upper arm circumference, it's not included. Edema of both feet present in both the age categories. Visible severe wasting not applicable in case of 6 months to 5 years, and less than 6 months it is present. Alright, so what you need to know is +2 standard deviation to -2 standard deviation is normal, above +2 is overweight, below -2 is underweight, right? And the criteria for SAM is less than -3 standard deviation. Alright, and criteria for chronic malnutrition is height per age. So these are the must know points in this particular classification. Okay, so with this I would like to end my session. One more thing I would like to highlight here is more than 95% of whatever we discussed, whatever came in the exams was covered in the app, right, already in the form of videos, notes, or MCQs, PYQs. Okay, so thank you so much. I hope you all find this session useful.